We're going to do, let me just review quickly what our agenda is for today, and then we will do some preliminary announcements and get started. So, council members, we have preliminary business, and I will ask you to share any reflections that you may have as a result of our experience yesterday. I'm sharing information and we will post here in Warm Springs, so just a heads up that that's coming. And then we have 2 action items and a lot of information coming at us today. So we're in this moment where the communities are actively working on hubs, and we've got a lot happening and churning through. So most of the informational items are to let you know what's going on, but we can go into any level of depth if you want when we get to those. Our action items today, when we take care of the preliminary business, which is the approval of our minutes from last month. And then we have a straw person report that is the result of the joint committee that we have been having with the policy board and a series of recommendations. We need to adopt those recommendations today, or a version of those recommendations, so that we can continue to look at a very more detailed operational level. We will have an opportunity for public testimony, and we will get folks out no later than 1 o'clock. Is there anything, council members, that we need to add to this agenda? And I think I'll just acknowledge out loud for all of us and for the record, this is the lowest attendance we've had at a council meeting, and it was not intentional, just a variety of things. We ended up inadvertently being scheduled at the same time as legislative days, at the same time as the school board meeting, which is why Rob Saxon is not here, at the same time as Norm's Greece vacation. So this came in this morning from Norm. I can't believe he's thinking about the council meeting when he's in Greece. I'll have to talk to him about that when he gets back. But there were just a number of conflicts. So it's unfortunate, but we will pick back up. And we are now, council members, on our meeting schedule and meeting every other month in this day-and-a-half format. So we are scheduled to meet next in November. And the meeting is at the bottom of your calendar. We were originally planning to meet in Medford for a variety of reasons, which we'll talk about as over the course of the meeting. We are moving that meeting to Portland. All right, any questions before we get started? All right, I'm gonna, before we get started with roll call and all of that, I'm going to ask Jenna to do some introductions. We have some new staff and some extra effort happening, so
Dick, do you want to come up here?
probably not.
No. So Dick Kaler is sitting in the back, and he is one of those unsung heroes for us. He traveled with us from the Department of Education to make sure that everything works right. But further than just what you see in the back of the room trying to hide from me, he is truly one of those shining stars for us. He has been amazing in terms of the transition to the Department of Education with all technical things. And so it's been one of those things that our lives would be miserable without him. So thank you, and I've got this certificate for you again.
And so while you're doing that certificate today, so I came looking for the baby shower thinking it might be up here, and I saw Dick underneath the table rearranging the room. So thank you for the extra effort. Very late last night.
The second thing I'd like to do is just do a real quick announcement, is that we were going to do a formal announcement of our new staff that are joining the early learning division. And they've been here for a day, so we have 2 new returnees to Oregon. They've been in other places, and the draw to come back to Oregon, which is what we know is absolutely what we want. So we have first Brett Walker. Brett joins us back in Oregon, coming from the Boston Public Schools, where he was working in community engagement programs in the K-12 system, and he's hit the ground running like all others. And next to him is Krista Shively, another returnee, and she has joined as our Race to the Top director to work with all of the Race to the Top initiatives, as well as has her hands up to her elbows helping us with some of the data reporting and some of those things. So welcome to both of you. She actually worked with the Transformation Center at the Department of Medicare and Medicaid. So when you think about transformation, this is exactly what we wanted to be able to see coming back. So, and then I just was going to say, we also have Kate Nass for a little bit longer. She is our interim chief of staff, and she's been absolutely amazing as part of that transition from the governor's office into the Department of Education. And also Lisa Harnish, who has helped make all these things happen today. So, and Megan, as long as you're there. I can't tell you how exciting it is a year later to have such a wonderful team to do this work. Alyssa, yes. This is your first council meeting because, as you all know, Seth is busy at home, staying very close, trying to have a baby of his own.
Well, thank you all for all of the work that you do. We really appreciate it. Okay, council members, let's consider the August meeting minutes, which are in your packet. Are there changes or suggestions to the August minutes?
I would move to
Is there a second?
A second.
Any further discussion? Any objection to approving the August minutes? Okay, thank you. The August minutes are approved. Council members, we had some of you were able to join us for all the afternoon meetings. Some of you were able to join us for part of it. Just wanted to take a pause, as we have done as we visit with other communities, to gather your thoughts and reflections after our afternoon spent here on the 42 campus. I'm sorry, I thought you were trying to catch my attention.
No, I was just trying to think of what I would say, because there was a lot. Mostly, I think, it was maybe just from our discussion afterwards, too, just concerned over, the institutionalized racism that we try to face, a lot of people face, and making sure that we do our best to not tell communities what to do, but have them tell us what they need to have us help them be successful and not be not successful.
Other reflections from this room?
I was aware of the importance of keeping language alive on all sorts of levels. But the piece that was moving yesterday was how strongly they had experienced immersion in Wasco or whatever the three languages they were teaching their children to be tied to the child's, that the word they kept using was discipline and self-discipline. And that people who were sharing with us were talking about you can't separate the language from spirituality, and that the children who got this immersive experience and were getting the language, especially if they were getting it in a home-based and a school setting, were far more, this is their experience, were far more successful in school and were far more successful in life. So it was an added understanding of the importance of language being kept alive on a very personal developmental level, that in all the things I've ever read about the importance of keeping these languages I've missed, the stories were powerful.
I was just going to follow up with what Bobby said. We were at a different table, and it was very impactful to me, very personal to me to hear the stories and how important their language and their spirituals was. I think that globally, I was talking to you later, I think that all cultures have this, that some can articulate it better, but that see that strong connection. And I think I just felt so honored that they were so willing to show up. That was just a lot of stuff.
It was a pleasure to see just some of the things that the adult Native tribal members try to teach their children, and one of the patience, which through their prayers and through their singing, and that was wonderful to see their values and experience that firsthand. What I was a little disappointed about was that we saw, or I saw here, what is happening in many other communities in the state that we visited, which is a disconnect with other local communities. So we had the economic business leaders of neighboring cities and counties attend yesterday, attend a meeting with some of the tribal leaders there, and there's not really that connection being formed really from either parties, either side. And so, you know, I wish that and I hope that that can be strengthened, and if we can do anything to strengthen that, because I think that's what we're asking for most communities, is to integrate, to communicate, in order to produce a more effective product for the children. So I hope that that will be strengthened later, and we'll see more connections forming from tribes, with tribes and their neighbors.
I would agree with all the comments. The thing that was striking to me was two things. One, the huge number of unemployment rates and the demographic that represented. And I was thoughtful about the connection to workforce and that same question about community connection and how it really takes the connection across all the sectors and then the residual effects of that. Also the housing challenges. That was a new piece of information for me, for folks on the reservation. And yet, I was struck because one of the comments I heard from one of the long-term tribal members was that even though it's so very difficult, we stick together, and they call it a protective factor. And I think that it relates back to the comments about the language and the connection to culture and how those things, even in the midst of severe challenges, create a sense of knowing who you are, and that becomes a protective factor that is being enriched by the work around language and keeping on top of that. So even in the direst, there's also a sense of connectedness that was inspiring to me.
Two observations. One, which was, I think, highlighted by the discussion from the business community, which is that all initiatives, all projects have a lifespan. And there is a critical time to demonstrate kind of either momentum or results. And if you lose that, you lose the ability to have the initiative be successful. And I was very much struck by the fact that the clock is ticking on us to a certain extent, that in Oregon, where you're trying to hold diverse interests, diverse geographies, diverse people together, you have a window of opportunity. If you don't seize it, you can lose it, and a lot of work will just be set aside for another new initiative or another effort. And I think it's really critical for us, and I thought we had lots of good feedback from the business communities, but it's really critical for us to be mindful that there's a timeline here of opportunity, and that it's incumbent on us to feel that pressure every day to move this thing forward effectively. So that was number one, and I thought that's what I was sitting there thinking as they were talking to us. Secondly, I think that the tribal relationship to the Early Learning Initiative is distinct. And it's distinct because the tribes are sovereign nations. Myron's organization works with the 9 tribes. To develop that relationship, it took 2 years of relationship building, trust building, and logistics planning. It was a very intense period, and it was very, very hard work and very hard to keep people at the table during the process. because it's too easy not to do that work. And so I think there's two things we have to be mindful here. Is one, the tribes are sovereign nations, so their view on what they want to do with their early learning component is distinct from others, and probably poses some unique challenges for us and opportunities. And secondly, there is really my biggest fear about the early learning initiative is that people will not do the hard work that is required by this vision. This is not a vision that lets people stay in their comfort zone, do what they've always done, and hope things work out well for little children. That's not going to work. It's really going to take everyone to make a very good impact. So I was mindful from our discussions with the tribes that if we're going to have a successful relationship going forward, we have to allocate staff time, emotional time, intellectual time, time to making it work, because it will not happen as a matter of years for anyone, including prospective public folks. So I think part of what we can do as a council to make sure that hard work is done is to keep our expectations high for those folks and to not settle for expediency or mediocrity.
Other reflections?
I agree with what Lynn said, but I still have to come back to this. Studying the community was at the tribe and not been involved in the Howard County in this area. And so even if they say, are you getting speech, what can you contribute to this, but they want to ask. And in the discussion on the way back, we were talking about, well, they are a sovereign nation. Are they? Yeah, or are they not? But why are we even asking that? They're children of Oregon. And when they were involved in the early years, maybe there would be the issues that matters. High school students were completely disenfranchised, no recognition of their language, no recognition of their culture, no expectations how to operate. If the dominant culture perceived the Native Americans as a separate, distinct, but included here.
So I think that's really key, and I think one of the things that to get something really hard done is you have to say, who is it out there that has the energy and last night, the people at my table identified, and this may be an opportunity for us in the public review process, is that Wasco County, for the tribal families who live on the boundary of Wasco County, the families there are, their kids go to a different school, and the school is not only embraces the culture, but embraces the kids, has a better attitude on the sports teams, etc. So, mental note was, as we're looking at trying to get partnerships here that are productive, I mean, the Wasco seems to have some energy to this. They seem to have some experience to this, and I think we can be a force of action by encouraging those relationships.
So I guess I would just say that, I experienced many of the same things that you all already talked about. The thing that you haven't said explicitly, and I'm going to just add it to the mix, and then some of it. So to add to the mix is the intergenerational nature of most of what we have already talked about. It's very evident and compelling to me. And so I think just to sort of sum it up, I think that what we are collectively saying by sharing individual reflections is that we as a council intend to be intentional in how all kids in our state, including those who have dual citizenship and our tribal members, are included in our collective early learning work. And that we want to do that in a way that honors the language and the culture that is so integral to the strengths that Bobby was mentioning, and yet reviewing applications as we get them, and an intentional move forward beyond that, how we engage in more of a government-to-government relationship with this. So we will ask that Jada and staff come back to us with some suggestions about how staff time might be dedicated, and we can touch on what that once we get, I sort of feel like we need to get through the hub miss, and then we'll come back to that. And I think that actually will inform us, given some of what we've talked about, the sort of the state of involvement or integration or lack thereof in the applications that we receive will help inform us in terms of how we want to move forward. So is that something that we somebody would receive? Great. So after hubness, the initial hubness gets established, we'll come back to this and we'll have another meeting. Okay, so Dick is down here. We thought we had Dick signing, but it was this Dick, not Dick now. So he's not here to do the OAIB update. I'm going to ask if Jada would do that since she was not here to do the OAIB.
And realize I know I'm a poor substitute for Dick now to be able to do that, but I have a couple things to share with you.
We get you a license plate.
That's we need to talk about that too. The Oregon Investment Board has looked at their subcommittees. I'd like you to pull out from the right side of your packet. The subcommittees, as you'll see, each of you have representation on every one of the subcommittees for the OEIB in the governance and policy. And some of these have either been repurposed or disbanded. So if you look at governance and policy, our chair Pam Curtis will sit on that with Matt Donovan from the Higher Ed, Mary Spilding, Julia Berman, Edwards, and Ron Saxton. On best practices in innovation, Yvonne Curtis is the chair, and we have Kim Williams and Lynn Saxton sitting there along with that. And then equity and partnerships, we have Harriet Adair and Janet sitting as part of that. And then personnel management and oversight, now. To that end, the only other quick announcement I have from OEIB is that they have put out a search and a job announcement for the permanent Chief Education Officer, and that process is going on, led by Julia Brim Edwards. The third piece that you would also know, and I had it in my report, but I'll do that now, is Peter Trumba was hired, and he is from the Eugene School District. And recall in the big picture of data systems is that there is a business case needing to be done for the longitudinal data system. And Peter comes to the OEIB on loan from the Eugene School District, and he will be working on the business case. We have put a spot for him on the early learning data work group, so he will be sitting there with Dana and Rob to be able to do that. So we're looking forward to that connection. So if you think about this, this is great. The other thing I would like to do is we don't have a specific date for our early learning, it's be in the next month. But one of the early conversations are that we may have some joint time with OEIB, which would be November 12th. So if you would hold the 12th and possibly the 13th both, and we'll get back to you as soon as some of those arrangements are made that I wanted to give you an update. And we'll do another to see. Yes, and it will be 12th or 13th. It will not be both. So I will in Memphis on those days. That's our national conference. Are you on that? I'm on that. I fly out Monday night and I come back Friday. Yes, that counts. Yes. Thanks for clarifying. And that's the
That is the, sometimes.
and that's the deal with no report for OEIB.
Thanks, Dick. All right. We are, council members, going to go to the informational section of our agenda. And what I may do is mix this up a little bit. So Dana and Janet, along with Terry and myself, participated as your representatives on the joint committee with the Oregon Policy Board. There is a document in your packet that Dana and Janet are planning to present to us. And then the action item is later in the agenda, but it makes sense to me that we are ready to take action on it immediately following the presentation. So I'll turn it over to Janet.
So Terry managed to be unavailable. I didn't think quite as quickly as she did. Last night, Dana and I were having a little discussion about how we would do this, and I said, well, I would introduce the topic, and I would point out that of all the people on this committee, I had the least experience in grounding in healthcare. And she said, oh, well, you don't have to say that. And I said, because it will be obvious. And Dana said no, because she's really nice. But I probably was the one that had to say more. Now, what do those letters stand for? What does this mean? But everybody was very kind and helpful. And I think what struck me the most about this committee is that everybody could agree on the overarching needs of having children ready for kindergarten. That we didn't have to debate that. We didn't have to say who's more responsible, who's less responsible. There were some other things to work out, on the detailed parts of it. And what does this organization require, and what does this organization require? One of the interesting tidbits of this, I think, is the screening efforts. And Dana and I were on the screening committee, which is still trying to muddle its way through. And we were first talking about who can do the screening, who's qualified to do the screening, and how many times should a child be screened if I don't trust that Dana knows how to screen. So one of our biggest hurdles, I think, is to accept that if you are trained to do a screening instrument, you are trained to do the screening instrument. And that is to be accepted. So we have some work to do there, and probably some of my colleagues in ECSE are the worst offenders at not accepting someone else's screening tool. So we're working on that. We also had some differences with some of the pediatricians about whether we should do one tool or the other tool. And we went back and forth on that, and finally we just kind of came to, let's just do a tool. And then Dana told me last night that one of the people who was most vocal about needing to do a different screening tool had emailed her and said, I think we should just require everybody to do the same one. And that wasn't her first choice. So it's been interesting to see people reflect a little bit and think of what's the higher good in this. And it's a tall order, but I think from this committee, everybody's just saying, we're going to dive in and do it. And kind of that metaphor of building the airplane while we're flying is, but seeing the people that we're working with, I just feel very optimistic about it. So.
Thanks, Janet, for opening it. It is really exciting for me personally to be able to share this proposal with the council because this is just at the intersection of all of the work that I do, and it's been such a tremendous opportunity to bring the council and the Health Policy Board together. I had the opportunity to present with Pam Curtis last week to the Health Policy Board, and so now we're bringing forth this proposal to you all today. So I will walk through some pretty high-level slides outlining the 10 recommendations that our joint subcommittee is proposing. I hope that you've had a chance to read the full proposal, and certainly we'll open up for questions as we complete this brief introduction of this proposal. So first, I just want to acknowledge, as already been done, the participation from the council, as well as to highlight the Health Policy Board members that were participating, as well as our executive sponsors, JADA, and then my boss at the Oregon Health Authority, Tina Edlund. And it really, truly, I think, to what Janet said, has been a tremendous group to come together over the last nearly 9 months. So the proposal really starts looking at some of the research behind the importance of the early period of childhood, both for important educational and health outcomes, as well as how those are completely intertwined. And I think this is what really led the understanding and need for this joint subcommittee, and was really ignited as Pam Chair Curtis came to the Health Policy Board nearly 2 years ago to talk about the direction of the council. So here we are, the group, the subcommittee was convened in 2012, December, and we've had a total of 7 meetings. one of the first charges of our committee, as we presented to you before, was to come up with a set of principles that would drive our work. And I do think that this proposal reflects all of those principles, as you've heard before, and as were highlighted in the proposal. And then also, hopefully you've had a chance to read a little bit about this concept, which is not new, but has been articulated in a more clear way recently over the collective impact framework. So collective impact really understands and recognizes that no single organizational or entity has sufficient power or resources to really get at the long-term and important outcomes we're looking at. So here we're talking about optimal health and early learning or kindergarten readiness. So really to frame where these recommendations are coming for, the intent is that at a state level, we work towards this collective impact framework across health, early learning, human services, such that we are supportive and helping to move along the important work that truly happens at the community level and will look different in each community. So that's the perspective that we bring forward this proposal. The collective impact concept has been written about recently. We shared the article with you. The authors have described 5 conditions of collective success, and that's how we have outlined our proposal. So you'll see each of the 10 recommendations come under one of these conditions, and that's how I'll frame it. So our first recommendation is that this framework, this collective impact framework, is adopted to join our Early Learning Council and Health Policy Board subcommittee work. Looking at that first condition of success is the importance of identifying a common agenda. We know that the major transformation efforts going on in Oregon really could be considered as an ultimate goal to position Oregon for global success and to really focus on also individual level prosperity and all that means. But for the immediate work of our joint subcommittee, we have identified kindergarten readiness, as Janet said, as a really easy conversation and starting point for this work together. Kindergarten readiness is a little bit less of a comfortable term at the Health Policy Board than it is here at the Early Learning Council, so we did spend quite a bit of time talking about what does that mean. But as I've described it, and for the purposes of this proposal, is that, of course, kindergarten readiness is the purpose or the goal that every child enters school ready to succeed, and that it's reliant, of course, on the important role of parents, but also a significant role of communities and the many systems that interrelate around that child and family. And certainly an important note to the achievement gap and health disparities that affect those outcomes. So we talked about many times in this context in our council about the snapshot of the kindergarten readiness assessment as an opportunity to both look forward and support individual needs, educational needs of the children through their school experience, but also the opportunity to look back and see how successful we've done at preparing children and families and what things we might need to do differently. So our second recommendation that came out of this proposal is that we adopt kindergarten readiness as our true common agenda for all of our work. The next concept area that we will address is the idea of a shared measurement system. And there's 2 related agenda items in here. And first, I'll try to walk you through this idea that we are proposing regarding a child and family well-being measurement strategy. So within each agency, group, organization, people look and measure success outcomes a little bit differently. And it's really hard to have a common shared language and to drive our agendas together jointly. So we have recommended that we adopt a statewide coordinated approach to measuring child and family well-being, that we have a dashboard that's publicly available. We report on those data, and we use that data to drive our strategic planning and our work together. We have put forward an initial vision of what those measurement areas would look like and some themes within those that are present in the proposal. I have not included them here as a really important starting point that was really driven by our representation of the subcommittee. We know there's a lot more technical work that needs to be done to actually identify specific measures and understand how we collect that data. So part of this recommendation is that we adopt this measurement strategy and that we work towards getting a technical advisory committee in place to move this work forward. The next important measurement strategy that we addressed is measuring kindergarten readiness, and of course this has been a significant portion of the work of the council. So the specific charge of our subcommittee was to develop a proposal and timeline for establishing kindergarten readiness as a shared outcome measure, not only for our early learning system, but for our health system as well. We use this diagram to really show how all of this is interconnected. This is only one frame, but we've talked a lot about screening, and that's been a common foundation for connecting early learning and health early on. But that's, of course, just a process to identifying children who are at risk or may need more supports or better coordinated supports. Again, that family and the services are coordinated and that we get to the outcome. So I think that's a framework that's been helpful for our subcommittee to think about. So we know that there are a lot of steps that need to take place to be able to institute kindergarten readiness through our assessment data as an actual outcome for the health system, and we've created a 4-year timeline with some pushback from the Health Policy Board that we make that timeline shorter. I would mention that here. So our recommendation is to adopt a timeline perhaps slightly shorter than 4 and with some urgency, in that in order to jointly push ourselves towards that outcome together, that we identify shared incentives as we go. The next concept within collective impact is the idea of mutually reinforcing activities, that we are not all doing the same activities, but they are all going to be coordinated towards that same shared outcome of kindergarten readiness. In order to meet that goal, we've identified shared learning as a really important process towards our outcome. So we, in this recommendation, have really asked or called out for necessary resources to support shared learning collaboratives as one example, as well as support for information technology as an example that will help support our shared learning and coordinated services. We also see developmental screening as a really clear, mutually reinforcing activity, as Janet has called out some of the explicits. We have recommended a statewide system for developmental screening with some specific core components that we would like to move forward and get your approval on the Health Policy Board to help us make this reality. Here are some of those components that we've identified as key to a statewide system of screening. I'm not going to go over all of them, but they address accountability, incentives, necessary baseline training, how we message the importance of screening, for example, developmental screening, and use that to engage families and community partners, and also to how we think about addressing screening and other activities that we do, and thinking about populations that may need to be addressed differently, such as those with existing developmental or intellectual disability, or those being served by child welfare. The next concept we address is this one of a backbone organization. This is really touted in the literature about collective impact as one of the most important things for success. We thought a lot about what should that backbone organization that covers health, human services, and early learning at this point, and we've come up with a couple of recommendations. One is that it is too soon to let go of this joint subcommittee. It is really important that this work gets solidified into the everyday work that we're doing at the board, at the council, at the agency level. So we recommend that this joint subcommittee continue forward with focus around strategic direction and help with governance. And we've identified some key agenda topics for this next year's work. So really implementing and overseeing that shared measurement strategy that I discussed, identifying opportunities to spread best practices around care coordination across systems, really focusing in on shared information exchange that would happen across systems, and then what do we think about the means for developing incentives across systems. So that's what we charged ourselves with our next agenda. We've also called out the Transformation Center as another backbone support, and let me describe that briefly. So the Transformation Center is the newest organizational capacity with the Oregon Health Authority, created to support the learnings and spreading of best practices across our new coordinated care organizations. There's been a lot of infrastructure put into that, and support technical assistance, peer-to-peer learning collaboratives, providing data quickly and as needed to help those local community structures meet the outcomes that they are charged with. We see a lot of opportunity for economies of scale and opportunity to utilize that organizational structure to support shared learning across systems. So we've started to do this already. My position at OHA has physically moved to sit in the Transformation Center, And we have already dedicated some of our federal funding through the health agency to dedicate towards this work between health and early learning. And we're looking for new opportunities. So our recommendations is that we renew our charter, as I've outlined, and utilize the Transformation Center as that backbone organization specifically for sharing learnings and spreading best practices across early learning and health. Finally, continuous communication, as we all know, is probably the most important out of all of this. We share a lot of different language. We've heard a lot about native language here, but if you think about systems language around education and health, it's been a whole new world to navigate for me. What is the technology around communication that we'll use across our hubs and CCOs for shared learning? So we have identified communication as a really important recommendation, and we've identified opportunities for shared communication technology to be utilized for hubs that will be similar to that or the same used for CCOs so we can facilitate these conversations. So that is the 10 recommendations, and I look forward to answering any questions.
Members, comments or questions? Yeah.
Can I just say thank you? That was an incredible amount of technology, incredible amount of work, and it was good work.
And Dana did most of it. People would be at meetings saying all these different things she was writing furiously, and then she'd come back and, oh yeah, that's what we said.
Can you talk a little bit more about the dashboard and the source of the data, the sources of the data, or is it just premature? I mean, is this more a concept and questions like whether it's population or service data are coming later, or, I'm happy to be told it's premature, this is a concept, I just didn't know how far you were.
So Councilmember Speech 7.
Thanks. So it's a great question, important one. I think I can just share some intent, and then the details of all of that will come and as we see some of the work of the technical advisory committee to help us on. I think the intent is that these data are pretty broad, and from a health perspective, we talk about it as the social determinants of health. It's not your healthcare delivery model, Medicaid billing data, which is where we often land because that data is easy to get, but it's a combination of data sources and data types. Process measures, outcome measures. Some of it may be aggregated from the individual level up, and some of it will be population survey tools through public health, or et cetera. So I think, as you see, this is broad. It touches on housing and food security, and each of those data sources are going to be extraordinarily different, and there are some challenges to figure out where we start and where our ideals are to get to. So I think there is a lot of work to come, but the intent is this is broad-reaching to think about truly the full perspective of impacts on families and children to reach that outcome. I'd open it up for Pam or Janet to share any other thoughts.
Bobby, I would just say that I think Dave is exactly right. The other, as you can imagine, this is a really interesting and spirited conversation to get to this point. And I think the intention is that these indicators, with all of the caveats that Dana said, are really proxies. They're not, for example, I'm just thinking one, where if poverty is not necessarily the measure for family stability, right? It's a proxy, or one of the multiple proxies. So I think that's the other piece.
So, congratulations on a great piece of work, all of you, Dr. McAlvey and Aaron Kelly-Seal and everyone on the team. It was a very impressive piece of work, and I want to say particularly how much I appreciate and value Dana's kind of 21st century skills and grasp of medicine, technology, and health policy dynamics, and we're very fortunate to have her and to have her style of leadership, which is really critical to getting people to the table to negotiate these agreements. The one thing I think we need to put on our plate as this has come forward in our public hearing from in the process to get to this point is the collective impact model is an important model, and the piece that needs to go hand in glove with it is, we can either call it financial modeling or process engineering, because the healthcare system has an entirely different venture capital model than the early learning system. And that will affect all of our implementation metrics, because healthcare, as people have reminded us time and time again, operates in this world where, there's sometimes a lot of money and sometimes a lot of money spent at a level that has not ever been paralleled in the early learning system. So I would just say, as we go forward with this, I think we all want to have on our green visors. That's very outdated now. But also look to the tools of process engineering and financial modeling to ensure that the needs of very young children get met in the behemoth of healthcare transformation in America. Because I know right now, much of the effort on the CCO side of the equation is very driven by both pricing strategies and adult metrics. And we've got to be sure that we hold this population at the table solidly with financial resources.
Thank you. I just wanted to echo the thanks for the wonderful report. I also wanted to thank you for also including and recognizing the importance of maintaining the Department of Human Services involvement in this process. So that's integral to the effectiveness of this report. So thank you for doing that.
So I'm going to show my ignorance and ask one question with regards to, I know the review process is also looking at data collection and dashboard concept, and I know Tara's very familiar with that. How does that play into this?
I think that's a really good example that everybody's doing this in a bit of their own way, and we're not.
Stop and
Oh,
say,
sorry.
what's the fee, and let's try to.
Sure. So Kim's question was referencing the work occurring right now in our state under the Maternal, Infant, and Early Child Home Visiting Grant that has been awarded. Multiple of them have been awarded to our Public Health Division, and data has been a big focus in that grant. And I think my comments would be that there is some great work going on there, as there are in so many different places, so many different grants, so many different agencies. And if we don't share a language or a vision for where we're going or how we're going to assess our success along the way, that it's hard to do this collectively. So how these get, how this broader shared measurement strategy that we're talking about, how each effort gets connected to that is going to be a work along the way. But I think that we need to start somewhere where we have a collective approach. And there's going to be important roles for different grants and different activities to have their own set of outcomes for their grant, et cetera. But we need to have a collective way to demonstrate that.
Thank you.
And I think that we had some conversation earlier this morning just about that and the importance of sequencing. What Dana said in terms of making progress for the same goal, we would just sort of scale it and apply it to data sharing, right? So there's lots of different efforts, and including the efforts that we will need to be about to assist the hubs, whoever they may be, in assessing their own progress. And so that has to be not another effort layered on top of this, but something that helps corral and collect and move toward the collective vision that where we're headed. So I think it's, I said this before, but I think this group has to keep saying, and we have to keep saying, how does that fit into that? How does this help us? And to have the courage, all of us, to do it.
I was going to go back to the dashboard a little bit. Is I don't know if you considered some bullets or anything, but under employment, I think this is where how does it connect with how are we making those connections? Because childcare certainly under the early learning goes under education, but I think it's also should go under employment too, because without access to care
That's a great point. For the purposes of this dashboard example, we haven't nailed down. I mean, there's been so many, just getting it down to this page. I think you're absolutely right, and I think that level of thinking is going to come, and certainly we have acknowledged that as a council, and we'll be able to carry forward those conversations. But the sub-bullets under each of these potential indicators, that's work to come, lots of work to come.
Basically, yeah, gosh, I agree, because there's no other that I thought of, but that was, that's the one I think about.
I think you could draw lines of connections to almost every one of these indicators that impact each other. Yeah.
So then the thought, it is a thought as a body that this work is separate from what is happening, but I'm hearing that there's also this parallel process of, there's lots of other pieces out there, child care information, administrative information, being information. At some point, all that technology will connect. And I'm not like putting, I'm just kind of trying to think about how does it look. Are we, there's silos and we're trying to break that. So what does that look like? And what's the approach? And is it just because we're beginning conversations? And so if these are, that's wonderful. That needs to start. But then what are the next steps?
Sorry to that, Dana. So, again, this is a distinct effort that should help with the ball, but and it should not add to confusion. All right. So, again, if we take the analogy that the work of this council, among other things, is the bridge between healthcare and education. And then there's a lot of data work going on in healthcare, and there's a lot of data work going on in education. We'll hear about some of that in just a little while. And this is an attempt to try to have a common approach and common language that we share with the health policy board. We do, this council established a steering committee that happens to be co-chaired by Dana and Ross Axman, to try to answer those bigger, how do they all plug in to that middle bridge that is us, and organizing all of this and moving forward. And then, again, to complicate it, but maybe to make it more simple in the long run, how do we initially, and the staff is doing a fabulous job on this, how do we initially provide data to the hubs so that they are able to evaluate a plan in a way that is consistent with what we're learning.
Thank you. Makes sense.
So we can't wait. If we wait to get all of the data stuff organized, this conversation with healthcare will be another 8 years down the road.
No, and that wasn't my intent. It was more of this is happening. There's lots of other things happening, and how do you get all this in?
We need to keep asking ourselves those questions so that we are not adding to the problem in that area.
Yes.
So, quick question, this is more professional interest than the council interest, but I'm intrigued by the notion that you were able to get people to agree to a common assessment. I mean, it sounds like you made progress on getting professionals to kind of simplify their requirements. Was there some secret sauce in that? Because that's a struggle kind of on a daily basis. And
Is it secret? We can't see
yeah.
it.
But was it a process skill or was it a intellectual higher ground piece? What happened?
I think I've been sitting here listening to the conversations, and I was thinking, we have to win their hearts and minds. And when we got off the topic of which, like you need to do this, and I think then people did have the freedom to kind of think it through. So we weren't hitting a brick wall. It was like, let's just get a screening going, and then I think as other topics came up and seeing the communication, how it could be shared, it made more sense to people. But one other thing, when Dana was talking about all the grants, we had a presentation of a grant that's from the federal government, I believe. And it's come to this group of people, and they're doing their own data and stuff. And so I said, well, so who are you accountable to? In terms of working into the Early Learning Council or the health, I mean, who? Well, no one. I mean, they're accountable to the funders to do the work they said they were going to do. So again, I think it's our job to win their hearts and minds, to say this and I'm not saying that group isn't on board, I'm just saying there are, Oregonians like to do their own thing. And so we were talking about federal Head Start or different groups. We really have to have a common commitment to doing this work all together because there is no overarching, forcing effort. And go ahead.
I just wanted to, I completely agree with Jenna. I think the conversations that were most successful were talking about our shared interests and overarching agreement about principles, about screening or systems and system pieces that need to be in place. We actually didn't come to a final decision to make a decision about a distinct tool that was put in policy across all systems. So I want to make sure I'm not overstating that. But I think the other pieces were actually more important and are going to drive the natural consequence that people are going to be looking for common language and a common tool that's looking for the same. So I think that's where we found success.
I would add to that I thought was critical was that we have a common metric. It's a developmental screening metric. It's ours, not to make an estimate, but it's early learnings metric and it's also a metric. And having a common metric that is articulated and shared drives us to say, gosh, it doesn't make any sense that you're coming out from here and we're coming out from here. So I think we made huge progress by having something that we shared that's very concrete, measurable.
Great.
Also, I think one of the things from the healthcare side was, well, the early learning community doesn't accept our screenings, or they don't send theirs to us. And so they do them again. And so when we just said, you're right, that is stupid. The point of this whole thing is that the children aren't going to be screened 45 times. And so I think when we just acknowledge that, yes, and it was on a lot of the early learning people, and then, I mean, it was kind of funny, I guess, that in some cases the early learning people really weren't using this particular tool in the way it was designed by the designers. And so, but I think acknowledging that there is work to be done on both sides of accepting and honoring and respecting other people's expertise. That, I think that was one of the big things that struck me. It's like, yeah, a pediatrician doing a screening, I guess I could go with that, not redo it. Vicki?
So this may be a dumb question, but I know, so across Oregon, the assessment will be adopted by all clinics in the area.
Which assessment? Are you referring to the kindergarten readiness assessment?
No,
the developmental screening.
I'm sorry.
Yeah, I get, that is the intent of the direction that we're going, yes.
So how will Indian Health Services, I mean, will they be included in that? Because they're not like the Oregon program, they're kind of on their own. Will our clinics also use this screening?
I think, again, stepping back to the overarching goal that we have a shared common goal that we're reaching to, that screening is happening, and that we have a common language, which in this instance might be a tool, and the results of those tools to share, that it would make great sense to expand that for all children, including those served in a tribal community. How those policies explicitly are played out, et cetera, I think are all to be, but it is really the intent for all children wherever their services will be met.
I think it's right, and I think that one of the things that this council should consider before we take action on this report is whether there are things that you would like in the recommendations to see adjusted or some additional direction given. Dana gave a great example. Health policy board, when we were there last week, if you look at page 8 of the report, that's sort of the 4-year time frame for looking forward to getting to kindergarten readiness as a joint goal, and the incentives and the shared screen. We would put a list of the health policy board said, no, that's way too slow. So speed it up. And that was so there may be something we need to plan or others. Something that we want to say as a council to the strength group
going forward, such as including IHS, and I don't know what language you should.
The Health Policy Council has already gone over this, and did they adopt all the recommendations?
I think it would be fair to say that they truly embraced the proposal and all the recommendations, with really the comments that Pam and I shared about the urgency piece. There weren't really any other changes. There were some technicalities of thinking about whether it was formally adopted and not, but I think the intent is that it was, really adopted and moving forward and so forth.
There was just so the formal piece will happen later, but yes, I think that we believe that all of the recommendations were endorsed with the urgency, with allowing the message to move forward with expediency, and that probably will put it next meeting just to seal that deal.
So then the thought that we might change this to a shorter timeframe would be acceptable, is that what I'm hearing? As well as maybe looking at, I mean, what we're looking at the United States, hopefully those and this is not out of consideration. Okay.
And I think because we had the opportunity, because we had the opportunity to go back to the policy board when we made the formal adoption, we would say that the council, formally did adopt with these changes.
Okay. And then this is more, I guess it's more following the things and just from my own perspective thought. Was there, I guess, is there going to be maybe conversation around the belief that children are being screened multiple times? Is there going to be some kind of look at that? It somehow, it touches a nerve with me, and just within my thinking, not in a negative, but kind of a heightened awareness. It's the same as duplicative services. In our communities, I know that doesn't exist. I don't think it exists in larger communities. Same with children being screened. In our communities, I would challenge that they're duplicating one because the tool itself is at different ages. So screening a child more than once at that same age, I don't think is happening. Is there kind of has there been conversation? That's all. It's just kind of a side note.
Well, referrals, again, I'll go back to one of the programs dear to my heart, early intervention, early childhood special education. And many of the providers, I think it's going better, but they get a referral and they send someone out to do the ASQ, the ages and stages, or have the family come in to do it. Even though the referral could have come from the pediatrician with a screening showing delays. So that's the level that we're talking about. Or Head Start does an ASQ and sends it. So that's an effort and a learning opportunity for people to understand. You get so caught up in thinking that your work is so special and you're so good at it. And one of the things when we were doing our screening thing was the BMI. And so there were healthcare people saying, well, teachers can't do that. And then, well, an educator can weigh a child and figure out how high they are. And you could put it on a little chart. And Terry, bless her heart, said, well, half the ones I get from doctor's offices aren't done correctly. I mean, in terms of graphing, because people are really busy and you're graphing. And so, I mean, some of us, that's one of the things I say, I always joke about the people at Department of Human Services are the busiest people on earth in their own minds. But then I think we all get caught up in that. Like, I just don't have time to work together. I can't do this. But if the dashboard and different things like that, when they are accomplished, you would see that there was a screening that had been done, and you could see the results of that screening. And then you should not do another one, or there should be a consequence of some sort.
My experience is the bigger problem is that people don't know these screenings. Now, rather than that I'm sure you're right, that sometimes they know, initiative, and they had worked hard, so they were reaching lots of children with developmental screening. So I hope that as a result of that conversation, that linkage was made. But the CCO is going to look a lot better simply by working collaboratively with the people who are already doing what their metrics show they weren't doing well, but the community as a whole was doing well. Is that?
So I think all of the above, at least from what we talked about in the subcommittee and looked at specific examples, all of the above are true. There are instances where screenings are redone for all of the reasons we just talked about and many others, including building trust with the family. Right? There are instances where the handoff doesn't get made, or one side doesn't know about what's happening. There are instances where maybe it happens, but because of how it's counted on the healthcare side or the early learning side, somebody else doing it doesn't really count for that matter. So all of those represent serious system issues, which is the point in having this committee continue to try to address some of those. And again, when we do address them, fundamentally it is pediatricians have to change what they're doing. I'm just picking on needs. Pediatricians have to change what they're doing. People who work in early intervention, early childhood special education have to change what they're doing. People who work in human services do, and that's where it's going to get really hard. It's hard enough here, but all of the above.
Okay, thank you. That was answering the question. That is a consideration.
I do want to suggest here, and I'm going to be a broken record on this, I'll just say it right up front. In the medical community and in the early learning community, there aren't a lot of process engineers. The people who have process engineers are mostly the hospital environment because of their cost factor and their need to control. And actually, it probably comes out of their surgical practice more than anything. So there are people in Oregon. We have a lot of engineers in Oregon. We have a lot in Washington State. And they aren't invested in, and this is their strength, they're not invested in how special every step in the process is, and they're also highly sensitive to steps in the process that if they get dislocated, create a quality problem. And I just want to underscore that in our work, every day, my favorite quote is a parent who came to me and said, "I think you're making my child worse because every time you assess him, he has more problems." And, he's had thousands of assessments and his picture just gets worse instead of what can we do. So I just want to underscore that this is an area where it's not just about how special my organization is. It is tied to the business cost metrics of every provider along the food chain. And so it needs an approach that is one step removed from the medical community or the early learning community to really get us to cost-effective models, because everyone will hold on to this piece tightly as this rolls out, because it affects their cost metrics and their licensures of their people and all of that.
So let's get a couple more questions and then we're going to move this to closure. Lily?
Thank you. Just wanted to go back to Vicki's topic really quickly about the tribal involvement in this piece, because since the subcommittee is going to continue, or that's one of the recommendations that it continues, is there any way, or would it be a good idea to invite tribal representatives, not as a member of the committee necessarily or subcommittee, but maybe as a liaison for their community to work along this process? Because I think we definitely don't want to leave that community out of the process and leave it up to them, since many are locally arts nations and we see how they can play a role in this process.
To that, I wanted to bring up an additional comment that came from the Health Policy Board, and I was forgetting to mention it sooner. They also recommended that there be CCO participation. We've been talking about this at the board and council level, and so to the extent that in this process and work, there's CCO representation, and as discussed in meeting for the council to consider a hub representation as those come on board to think about those people at the community level and impacts and how, again, at the state level, we can best support that work. So for you to consider as a council.
So I made a couple of notes, Council. I'm sorry, a couple of notes to just try to bring a finer point on some of the things that we've been discussing that we may want to consider as we take action on this report. The first is that we ask that the equity lens be applied to this work, and in particular, second point, as a result of that, that as the work goes forward to go to the next level, that in addition to CCO and hub participation, we consider IHS and tribal interface as well. And then the third point is that we consider the use of sort of neutral skill sets that can help with this forward, such as process engineering. Are those answers what we said are shaping us going forward?
And the explanation of the process, so forward to maybe looking at a short.
And a short, and we would endorse the policy board's urgency. Okay, may I have a motion to that effect?
I would move if we conversation we just had with those decisions.
Second. Is there any further discussion? Okay, so the motion is to accept the report with sort of 4 clarifications or additional parameters. The first is the urgency of the policy board. The second is the neutral work to help us move this forward, such as process engineering. The third is the application of the equity lens, and the fourth is the additional participation of all the campus career, which is inclusive of CCOs, noted in the hubs, noted by the policy board, and then we would add IHS and tribal interest to that. All right, council members, any objection to that motion? Okay. Now approved. Thank you very much. All right, council members, we are going to take a break. We're going to load up a presentation that will be coming soon, and we have a little celebration and proclamation to do right after the break. So we are going to be on in recess for about 10 or 12 minutes.
Out of our rooms? Check out is 11:30, but if you ask the front desk, they can extend it to 1.
Oh, okay.
Yeah, so if you need an extension.
Well, I mean, I don't really need it, but I haven't checked out.
No, that's fine, yeah, 11:30. Yeah, so if you, and it's pretty quick to check out, so if you want.
It's just what I need
stuff.
getting it out.
Right. Okay.
You can average that.
Yeah, exactly.
Y'all need to pay attention. Is this the right one? Okay. Shoot, that's really good.
Grandkids even more. Yeah.
Yes, no, please do. I can connect you. She answered and some of it didn't. If you need to connect with her, absolutely. Be careful right here. There's a big kid. They were late to theirs.
I do. I would love that. I would love that. That's why I'm here.
What time is it?
This baby feels like it's from today, I'm sorry.
Oh, stop it. I'm right in the back.
When she came down and I saw you in the bottle, I thought,
Thank you. We have a doctor here. That's good. No, I'm not there.
I just really wanted more flexibility, more time to do things on my own schedule. And social security. I really want that's what
Yeah, this is a nice place to kind of end to substantial work around there. Or to get it off to a good start is a better way to look at it.
alignment that you're.
Vaccine on the Right. All in the back window. Yeah. I feel like the dogs do. Okay, council members, we're going to go ahead and get started. Where's your picture?
Oh, you're doing that before you're doing this? Okay. Okay.
Okay, council members, we are going to go ahead and get started. We're back in session. If you can make your way back to your spot. The next item on the agenda, we're still in the informational section of the agenda. And just to give you a little bit of a map of where we're going from here, we have a fair chunk of time allocated to a report on data from the Oregon Crew kindergarten program. And we'll get there in just a moment. But before we do, a very exciting proclamation. So, Krista.
Thank you so much, Chair Curtis. I'm here this morning to share the information that a few weeks ago we received a request from the Oregon Head Start Association for a special proclamation for October to be Head Start Awareness Month. And I wanted to share a little bit of history about where this comes from. On October 22 in 1982, President Ronald Reagan proclaimed October Head Start Awareness Month. So 31 years later, here we are talking about early learning in really a heightened awareness kind of way. He made a quote, though, that I think is important to hear and also to think about. Perhaps the most significant factor in the success of Head Start has been the involvement of parents, volunteers, and the community. Their commitment and the services provided by dedicated Head Start staff have been instrumental in creating a quality program that truly provides young children with a head start in life. And so just as Head Start many years ago started that, it's nice that in this moment we are conjoined with a vision of our state around that very same idea of connecting parents, volunteers, and community towards creating the best Head Start, the best ready for kinder group of small Oregonians that we can. So today we're
Small Oregonians.
Small Oregonians. Oh, big people, little people. It's kind of fun. I'm here with Teresa Martin, who is representing the Oregon Head Start Association, and we are happy to present this request.
Great. And so I've had in response to the request, a proclamation signed by the governor. I'm going to stand in my seat so that it can be mic'd into the record. I'm just going to read the proclamation and then Teresa will be able to present it. So the proclamation says, and I will shorthand some of it, whereas Head Start in the state of Oregon is now in its 47th year of meeting the needs of low-income children and families. And whereas since its inception in 1965, Head Start has provided health, educational, and social services to more than 20 million children and their families in every U.S. state and territory. And whereas to achieve its goals, Head Start provides for the educational and exceptional needs of children, as well as social, psychological, health, and nutritional requirements. And whereas in addition to focusing on the needs of children, Head Start involves parents and decision-making policy councils. And whereas in 1987, Oregon staff
fund an Oregon pre-kindergarten program modeled after the federal Head Start program. And Oregon pre-kindergarten program has grown to more children in Oregon than federal Head Start. Now therefore, I, Johnny Kitzhaber, Governor of the State of Oregon, hereby proclaim October 2013 to be Head Start Awareness Month. And Teresa, I think your program in Madison is all Oregon pre-kindergarten.
Yes, we are all Oregon pre-K.
Can you tell us a little bit about your program, and then we'll...
Wow, wasn't expecting a speech. Our program is 110 of our local kids in our Madras area of Jefferson County. We also have childcare and we have preschool also in our program. So, and then we actually house the federal program from Mid-Columbia Children's Council in our building. They actually rent from us. So we actually have it all kind of in one location. We actually have OCDC across the street from us, so there's kind of this little early childhood little grouping, and we all work together very well. My program has grown from 80 when I started a few years ago to 110, so we've been growing, and we are have wait lists every year. We're actually getting more and more kids even wanting the preschool program that we offer, so that's kind of going to what everything is going in the state of Oregon, that we're getting more and more requests for that early childhood piece.
Thanks for being here. We really appreciate it. Now, in order to continue the Oregon Kindergarten theme, Lori Danke is with us to share a data report that I think is not going to make public. Is that right? Or it hasn't?
No, it hasn't gone completely public yet.
So sneak preview, and you have some information at your slide, some presentation slides. So I'll just turn it over to John and to Lori.
Thank you, council members. My goodness, it's really nice to sit here on this side of the table with Lori to be able to do this report. And I want to take you back to prior to when I came, you adopted a kindergarten assessment, and I want to make sure that you understand that the information that we're going to share today is about the Oregon pre-kindergarten 3 and 4-year-olds. But what is important is, I think in your consideration, you looked at the Teaching Strategies Gold as one of the instruments that you looked at for kindergarten. So it's a wonderful instrument that is used, and both Lori and Nancy Johnson-Dorn have worked very hard to have a consistent measurement that was used by all Oregon pre-kindergarten programs and Head Start in the state of Oregon. So this is a long time coming. They've worked very hard to do this, and I think that what we want to do really is honor this work because of the fact that for many years, as the legislature asked, what kind of data do you have, what kind of outcomes do you have, they had no consistent answer to do. So as you can see, and you're going to hear from Lori, that they have some outcomes that are pretty promising and exciting. Probably the best part for me is Lori retired on September 1, and she came all the way out here to share this because she's very excited about this data. So I'm going to let her give the report.
The travel part was the best part, not return.
Yeah, sorry.
Well, thank you very much for this opportunity. I'm really excited to share this data. It's exciting to share this right after the proclamation. I realized as Krista was reading that, my first experience with Head Start was 3 years after it was founded as a high school volunteer. My mom kind of took me by the ear and said, "You're going to do something useful." And if you need a testimony for youth volunteering shaping people's lives, that was it. I fell in love with 4-year-olds, and I spent a brief stint in elementary school, but I kept coming back to these guys because they're my absolute favorite group of children, families, professionals. The dedication is really exciting. There's always been a lot of passion and a lot of anecdotal information that we knew that Head Start was making a difference. But we didn't always have the tools to demonstrate that and to tell that story publicly beyond just isn't this kid cute and doing well, and didn't we help this parent? So as the tools improved, programs started doing more specific measurement of child outcomes across the developmental domains. And there were a variety of tools available. It was a little difficult to compare apples and oranges. So things began to head towards a consensus, and we now have TS Gold with this year 24 of the 28 programs that receive Oregon pre-kindergarten funding will be using TS Gold, and the remaining 4 are expected to come on in 2014, 2015. So next fall. We took the data from this year. We have a state umbrella agreement, which means that the Department of Education has access to the data from all of the programs. And interestingly enough, there is kind of a dashboard. You can go in and look at different things. We can look at how much data is being entered. We can look whether programs have completed checkpoints. Programs can do a lot of tracking at the individual child level, the classroom level, on up through. And at the most important part of an assessment is that it be used to plan and inform instruction. And that's really the primary focus. But we also have this tremendous benefit now of being able to aggregate that data at the state level. And what I'm presenting today is information from about 4,800 children who were 4-year-olds who completed a full year of Head Start. They were assessed both at the fall checkpoint and the spring checkpoint, representing 19 programs and 2 programs that had some pilot sites. And they represent about 78% of the children of the Oregon Head Start pre-kindergarten children who entered kindergarten this fall. So we looked across domains, and I used a benchmark that TS Gold has available in its reporting system that they refer to as a kindergarten benchmark, and that is the developmental level that children should reach before they enter kindergarten. And so this graph shows the percentage of children enrolled in the percentage of those 4,800 kids who were meeting that benchmark in the fall, this is blue, and then the percentage of kids that were meeting that benchmark in the spring, which is green. And it's pretty exciting to see where they're coming out. 90% in social emotional, and we know from the kindergarten assessment and from a lot of the research that social emotional is often one of the biggest predictors of school success. So the fact that we've got 90% of our kids reaching kindergarten benchmark in social emotional. Remember that all of these children are either living at or below poverty level or have another significant risk factor. So these are the kids who are most at risk for failure. And so this is really exciting data to see across the levels. The lowest area is mathematics, and that's an area that programs are looking at very closely at the program level. We did some training, because we were seeing this data trend, we did some training this summer where we had teaching strategies come in and do some very specific mathematics training with education supervisors and leadership staff so that we can start to bump that. The awareness, there's a lot of research out there that says that early childhood folks are not using a lot of mathematical language with kids in their care. And so we're now very aware of this. We have the data and we can tackle it. Programs are focusing some of their in-service training efforts on this to work on bringing it up. We also have
question. How does the hold assessment compared to the kindergarten readiness assessment?
And we'll get that,
Okay.
it's a good question, and we'll definitely talk about that. That's the last set of data that I'll show you. So.
Thank you.
We were able to disaggregate the data. The group that we had the most data for were for children whose primary language was other than English. And so this compares across the domains how children whose primary language was English, the blue, with the percentage of children whose primary language was other than English. And we've heard a lot at all levels about closing the gap and narrowing the gap. To me, this is one of the most exciting pieces of data in the whole report. It shows that we had a lower percentage of English language learners who were meeting social emotional benchmarks in the fall. And in the spring, their social emotional skills are actually exceeding the percentage of kids that have met those benchmarks exceed the English-speaking children. And I just think that's a really fascinating piece of data, and I think part of it is because if you're learning two languages and you're code switching, you have to be very aware of what people are saying and doing. You're tuned into body language. It takes some social skill to negotiate two language. So it's not really surprising, but it is exciting to see that. They also not only narrowed but exceeded the gap in meeting physical benchmarks. In language benchmarks, the English language speakers are still a bit below the native language primary English speakers. However, you can see that the gap has narrowed considerably. The gap in the fall was 19 points, and the gap in the spring is 12 points. Cognitive, this is really exciting too, to see the gap almost completely disappears in cognitive. And this looks at a variety of skills, problem solving, some of the approaches to learning type of things are measured under the cognitive area in teaching strategies goal. Literacy benchmarks, again, the gap narrowed considerably. In the fall, the gap was 13 points, and in the spring, the gap was down to 8 points. And to have 81% of our kids who are non-English speakers meeting literacy benchmarks is pretty exciting. Mathematics, this is the one area where the gap did widen. And so when you think about it, if we're not using a lot of math language with all of our kids, and then we have to translate and use more math language in the child's home language so that they really get those concepts also, it's a challenge. So again, this gives us some really good information about things that we can focus on and provide training and technical assistance to programs. Any questions on the disaggregated data? Yes, Vicki.
And I don't mean any disrespect, but it would have been nice to have the childhood starts, those 5 in the morning, included in this day.
And this actually, Siletz is now under the umbrella. They chose to come under the state umbrella, so we have access to their data. The only reason the tribal programs are not included is because we don't have access to the data. It's not submitted to us so we can't see it. It would be very nice to have that data, and that's a discussion that we've been.
I would love to show you that.
Yeah.
You know how to do that, and I think all the other programs would as well.
Yeah, and I think, as I was saying in the beginning, the reason we can do this aggregated state-level data is because all of these programs are under sort of a super umbrella license that the Department of Ed has. And we do, we have other programs that are now interested in that. The other advantage of it is that the umbrella license is the cheapest cost for the license.
So is it state licensing is what you're talking about?
We have, the programs actually pay for the assessment portfolio for each child. They pay for it out of their grant. But because we have the state umbrella, they only pay $9.95 per child to have them in the system. And then the state has access to the children's data, to the data, so that we can do the rollover reports. If a program is not under the state umbrella, we don't have a way of melding, of merging, aggregating their data at this point.
I think this is wonderful discussion. I'd like to let Lori go ahead and finish, and then what we can think about is how we look at this moving forward, because this is kind of our beginning point with this, but
Yeah.
Yeah, I have a number of questions, so we'll hold unless we have some questions about particular slides, and then maybe
Yeah,
we'll do
sure.
broader and then, okay, great.
Any other questions about the disaggregated slides? Okay. And we will be able to disaggregate for race, ethnicity, disability, other types of sorting and shuffling. Eventually, we'll be able to look at if there are other types of programs in. We can disaggregate for type of programs. We can disaggregate when it gets really sophisticated. We'll be able to disaggregate for kids who have had 1 year of Head Start as opposed to 2 years of Head Start. We just put in a question that's in the system now so that programs can identify how much previous Head Start or early Head Start experience programs that children have had, so that we can begin to look at what are their dosage issues. Okay, now you asked about how this measures up with the kindergarten assessment, and starting on page 6 of the document, what I did was I went into specific items in TS Gold that were most closely associated with the items on the kindergarten readiness assessment. So the kindergarten assessment looks at the letter recognition and letter sounds. So I pulled data for 2 of the items on TS Gold that were linked to that. And we had 81% of the kids were identifying and naming letters, and 82% were using letter sound knowledge. Now, one thing to consider in that is that in the kindergarten assessment, that's a timed test, so it's the speed in which they do it is also measured. This is an observational assessment, so it's if the child points to a poster and says, "Oh, there's a B," yeah, we can check off B. So, number operations, again, this is an area where there's some room for improvement, but they're still doing pretty well for the group that they're in. What gets really exciting again is that those items that are linked with the child behavior rating scale, and because the child behavior rating scale is an observational assessment, and this is an observational assessment, we're really comparing very similar items that are measured in a very similar way. And we're really seeing that this is a very strong area for Head Start, which is not surprising because it started out as a program that was focused on social emotional development. And so those are some of the items that link with that. Other questions or concerns or comments on this? Nope.
Okay. So council members, We were very excited to see this result from the Teaching Strategies Gold, and I think, Marlene, you brought up the question, how does it correlate with the kindergarten assessment? And I think that what we really wanted to show is that from the Oregon Pre-K and the Head Start, they've come a long ways to be able to get programs together to do this. There still are some that have not, but I think what it points out is that we have 45,000 children that start kindergarten every year, and so we still have a long way to go to figure out what kids know before they get to that kindergarten. These are the gold standard in terms of the funding levels of children in the Oregon Head Start and Head Start. This is the program that has been around, as you just did the award. But that we still have to look at other groups to be able to figure out how to measure them, and then also look at what we're going to do. So this patchwork of programs also affects how we also look at the kids who get some assessments and don't get assessments as 3 and 4-year-olds. Vicki, this is a really good point, and what we would like to do is add to this. This is and I think these are some of the differences. We have the tribal Head Start, we have the federal Head Start, we have the state-funded Head Start, and then we have the others. So this is some of our work moving forward as we look at basically putting these things together so we have a better snapshot in 3-year-olds and 4-year-olds. But it was pretty clear data that you could see, and it shows improvement from the beginning of the year to the end of the year, and I think that was pretty exciting for the Department of Education in this effort, because how long have you been putting this forward? Is this your 3rd year to work on this?
I mean, to TS Gold? Yeah, this is, well, I've been trying to do aggregated reports since I started. That was 6 years ago, and we could do them with some systems and not others. There began to be a critical number of programs that were using TS Gold, and then as that path narrowed, we've really been able to bring on more and more programs. So it's pretty representative of the state.
So I just want to understand this issue that's already been raised. The agreement that the state of Oregon has with teaching strategies that produces this reduced cost and also the benefit of aggregation is because state dollars are flowing to the organizations. So if they aren't, it's like, so I'm trying to think for tribals and for OCDC, because is the barrier that the state does not fund those programs, and that makes them not under the umbrella?
The only barrier is that we can't, because they're not receiving state funds, we can't require them to use the assessment. But if they chose to use it, yeah.
Could they get the $9?
Yeah.
So you could go to OCDC and say,
Yeah.
if you want to be under this umbrella, you can get it for $9 per child.
Well, and one of the complicating factors, and I just learned this recently, is that we have this umbrella agreement for the state of Oregon. There is an agreement with the American Indian Alaska Native programs. They have an umbrella agreement so that their data can all be aggregated with TS Gold. OCDC, I think, is also getting the same rate for their migrant seasonal program, but we don't aggregate those kids usually into the state numbers because it's not the full.
It's just complicated.
Yeah, it just gets complicated.
It's going to be complicated to get an Oregon picture.
Yes.
Right now.
But couldn't we, as programs, just submit that information to you and you could enter the data in?
It's if there are the data people at the department to do that, that would be possible. The data people at the department used to be just me, and my Excel skills weren't quite up to it, but.
So Vicki, that's a great question, and because Lori is now on Lori time, I will take that information and we will work with that. Thank you.
This is beautiful, and I can see this when we know what legislators, and just for us, so it's wonderful. My question is, twofold. One, will directors get this information at the directors conference next month? And then the other is there going to be a way to take, because this is state information, and compare it, because that's OPK only, UTS Gold, and we do our annual download and identification. Is there a way to compare these now so that we can say where we are within the state as a program? That might be it.
Benchmarking your program against.
You could run, the reports that I ran to do this are available in TS Gold, and you can run them for your program.
Right, and I know I can do local reports on this.
Yeah.
But my question is, state comparing,
You'd have to ask somebody at the state to run the data. They're the super administrator, the highest level of administrator to run the data. So you can't run data on other programs, you can just.
So I actually had a couple reasons. One is the fact that this is information there, but I think probably this is going to be our future work in terms of how to figure out a coordinated approach to be able to use some of the data that we have, which is, I think it's a perfect example. But any other questions to add to it? I've got Vicky's. We also want to look at, is it going to be done for the directors group? And then the third piece is how do we look in the future to benchmarking programs?
We have both Lynn and Krista.
Thank you. This is exciting and it's really fun to look at. The opportunity that we have with the Early Learning Initiative, where there are benchmarks and metrics in place, is both to compare ourselves by health zones, publics or areas. And the second opportunity we have is to evaluate the return on investment of increasing the scale of performance of individual services. And so, for example, when you are getting certain levels of outcomes, the question becomes, if we cut that wait list in half, can we hold on to those outcomes maybe at 2 or 3 percentage points lower, but for the same amount of investment? And I think that's the piece we're going to be bringing to this discussion, because our challenge is bringing excellence to scale within financial resources that we have. So I think this is really a great data in terms of looking at those opportunities as we go forward, because this is the foundation of doing those extrapolations of what increase in scale within cost management.
Well, and I think just to round that out, and then go to Krista, is when we do have data coming in from the kindergarten readiness assessment, you'll remember Councilmember, we wanted an assessment tool that would allow both a formative assessment going forward for kindergarten teachers, but an assessment that would allow us to look back and match it up with this exact sort of data. So at some point, we should be able to say, for kids coming out of Head Start, what does entry to kindergarten look like? For kids coming out of Montessori and looking at what does that look like? And so that we look collectively at this point that you're talking about. These are fabulous, and it represents about 7,000 kids, or less than that actually, who's participating. But if all the OPK programs ran, it would be possible.
When all of the OPK programs are participating, there will be data for over 12,000 kids, and those will be 3 and 4-year-olds. And about 66% of our kids are 4-year-olds.
So I would just add that if we don't have a parent survey or some or integrated data systems that allow us to know more about the children, attributing the success to the program or the lack of success is very problematic. So I just want to add a footnote to your comment that we've got some other work to do so that those are meaningful comparisons. Because if the child started here and they moved to here, it's really different than if the child started here and moved to here. And so we've got some work to do. Just a footnote.
We have a lot of activities. Okay, so Krista, Marlene, and Melissa.
Just to that point too, I was wondering if you could speak just a little bit about the notion of ongoing assessment as a quality component of a quality program, regardless of what the name of the program is or where it comes from, and how this kind of assessment, right? You mentioned that it has something to do with informing instruction. And so I'm thoughtful about how an ongoing assessment and instruction might be linked.
Well, because this is an ongoing assessment, teachers are documenting children's progress throughout the year. They, at the end, 3 times a year, they look at all of that documentation and determine at what level a child is performing, and that's where they get their fall, winter, and spring. They can then look at which kids are working on particular skills. They can break it down to the specific skill level, and then group those children to work on specific skills. They can see when they're plateauing and maybe need to change things up, or they can see where there are gaps. We all have areas where it's real easy for us to observe because they're things that we're real excited about. One of the things that's interesting in this report is the N for mathematics is the lowest N in the whole group. The number of kids that had fall and spring math scores was lower than any of the other areas. And one of the data limitations is I think that early childhood teachers are a little more uncomfortable measuring in that area, so they left more places blank. And so but now programs can see that. An ed coordinator can go in and see that, this teacher really isn't entering much documentation for math. It's time for me to go in and work with that teacher to see if we can't get more things happening.
Thank you.
Thank you. I'm a little disappointed to hear that we're not getting more information from OCDC because it's capturing the migrant population that gets into our school districts and becomes the at-risk youth a lot of times and have special needs. And in addition to the tribal Head Start. So I would just ask, or try to see how we can incorporate those two programs. I know in Oregon, we're having a tough time moving OCDC into the conversation of the early learning work. And so, but I think that, I hope that at a state level, we can try to get that incorporated more into these efforts, or else we're missing a large part of our population.
And when we look at the demographics in here, I think, 45% of the kids are of Hispanic background, and almost 30% of the kids are Spanish speakers. So even within this group, we're getting a pretty good chunk. We're getting some pretty good information about both the Hispanic population and also Spanish-speaking children.
Laura, did I hear this correctly? That the OCDC is using T as a goal. It's just that it gets rolled up for the migrant Head Start program?
Okay, OCDC actually has a migrant seasonal grant, and they also have a state grant. So they're actually what we call a state only as well as a federally funded. They don't blend their funds because the programs are different. Our Region 10 Head Start programs blend their funds because the programs are the same. So this data does include OCDC's pre-K, OPK kids. It does not include the migrant seasonal kids but they can give us an aggregated state picture of how those kids are doing, and that could be compared to this. But it is important to remember that the migrant seasonal programs, sometimes those services are as short as 6 weeks of service as compared to 32 weeks of service that these kids are getting.
So what we wanted to make sure, go ahead. Okay, go ahead.
Jim? Or Jen,
I was one of my thoughts was that you do have some information because of
The state only, the OPK kids are in.
And I have a question. The numbers of children, do they include the federally enrolled children as well?
Yes, because, while the state funds over 7,000 slots, the feds around 5,000 to 6,000 slots. But the programs that are receiving both state and federal funds, they have all of their kids on TS schools. We get all of those kids.
And is there any program left in Oregon that does not have OPK?
The only one, the tribal programs and family building blocks, which is an early Head Start. But all of the Region 10 Head Start programs in Oregon also receive OPK funding.
And then one other thought is the common identifier. If and when we have that will allow for better following children from these different programs to their success in school. Right now, I'm on equity partnerships, and one of the challenges is they don't know where preschools come from. As well, every program keeps a significant amount of data, but there's no way to say which children came from Head Start or early intervention, camp, or different things, because there's no way to say, yes, you are here, now you're here. So that's just one more reason it would be helpful in the contract.
I've seen a lot of these reports, and as a non-expert on data, sometimes they worry me, and I could be wrong about that, but it occurs to me that what's missing from these data are control groups. That what you show is what happened between fall and spring, and something was going to happen between fall and spring anyway. They also don't show where the kids are that are in the program relative to what's theoretically normal. So if my concerns are valid, for those of you that are better, more expert at data than me, I have a suggestion. I think we're collectively paying TS a lot of money. It'd be interesting to have them place a single benchmark in both of those categories as to what is sort of the average of someone who's not in a Head Start program in the fall and not in a Head Start program in the spring, so that we can see how the kids have moved relative to normal. Otherwise, I think there's actually a political risk that you look at this and people, if I'm right, people like me say, well, this is just comparing kids' normal development. It doesn't tell us enough, and I think it probably undersells what gets accomplished if you didn't have those benchmarks. So, just a suggestion.
There are some ways within the TS goal to do some other types of comparative reports and to look at some of that data, and it's getting increasingly sophisticated. The only problem with the control group is that this is an assessment that's designed to be used in a center-based classroom. So we don't,
with a specific
with
curriculum.
with a specific curriculum. So it's hard to, it's a little hard to do the control group. However, it could be possible to ask teaching strategies to disaggregate their data at the national level and I think they're doing some research on that, looking at different groups, but I haven't seen that research yet.
Or it could be going to the research literature for what's a normal developmental trajectory between fall and spring for a 4-year-old. I think that's really what you're asking. You want all of this to be controlled for normal development. I can't think fast enough of the method you would use to do it.
And this specific report was really not looking at measuring progress. It was simply identifying how many children were at the benchmark in the fall and what percentage number of children were at benchmark in the spring. You would, when I talked to the folks at Teaching Strategies, they did say that our kids in the fall, we had a lower percentage of kids that were meeting benchmark in the fall, and that by the spring, that they were meeting about where everybody else was, if not higher.
And because those two data points are not in your printout, it's literally a black line on each of those graphs that shows teaching strategy goal benchmark for
What the average was,
would be breathtakingly useful.
Yeah, that's a really neat idea.
Just a comment, there are programs that are year-round, and our program actually does 3 different assessments a year, and it's really great data to know that kids don't progress and how well they're doing from summer to fall, because they don't progress because they have some summer. So that might be a piece that we might look at as well.
We also have programs that have both part-day and full-day offerings, and they look at, not surprisingly, their full-day kids are doing better.
So another just a little bit different question. So I recall 3 or 4 years ago when the effort was put in place to get this assessment across started programs, and in mind that we are rolling out kindergarten readiness assessment, and that this council has plans to roll out quality standards for all early learning environments, not limited to center-based classroom environments, not limited to educating classroom. Sort of a historical review, Lori, where you sort of go off into Lori land, as Jana said, sort of what was the experience? And I don't recall there was some resistance. What was the experience of putting an assessment in place? Advice thoughts that you don't have for us as we think about doing that more broadly?
I think it's taken a long time. When I first came, the very first year I was here, they had just implemented a statewide assessment. It was a one-time, point-in-time assessment that was not linked to curriculum. It was on top of a required an assessment that was also required by the Office of Head Start, the federal Office of Head Start. So now programs are required to do 2 separate assessments that weren't linked to ongoing instruction and curriculum. And there was a lot of pushback. The federal assessment went away and the state assessment went away at the same time. So we had, actually one of the things that helped, we had, there was, Janet's program was one of the programs that used an assessment called Galileo. And we had 6 programs that used Galileo, 2 of whom were very large and the rest were pretty small. But I worked with the Galileo people and we could do an aggregated report of that data, and people got really excited about that. But at that point, we still had staff that were getting used to computers, to online assessment, and that was a challenge. Historically, the creative curriculum, the precursor to TS Gold, was used by the majority of programs in the state, and the 27 of our 28 programs use creative curriculum, which is the curriculum that's associated with TS Gold. You don't have to use it with TS Gold. You don't have to use TS Gold with create a curriculum, but the majority of the programs were already familiar with that, and it was an ongoing assessment that filled that primary purpose of assessment, that it informed instruction. Yes, we could get state reports out of it, but it was something that was useful and meaningful in the day-to-day work that programs were doing with children. And so the department actually did an RFP process to select a single assessment and set up criteria that it had to be online, it had to provide technical support, it had to have an inner observer reliability factor, which this does have and the programs are now completing. It had to have, and through that RFP process, TS Gold was accepted, and there are some programs that we're not happy with it. Change is difficult, but I think part of what's making a difference is seeing the power of this data and being able to compare to it. So
council members, I'll just remind all of us who are on the council at the time that the council adopted the kindergarten readiness assessment, and just those of you that weren't as well, that TSO was one of the assessments that the council looked at through its committee and opted not to use TSO, and instead to use what we ended up proposed was the composite approach, and you can see how it links, but just as a reminder that we opted not to use this.
And I also would just like to add to that too, because I came from the north in Washington State, and they adopted this as their kindergarten assessment, and it has not gone well in terms of implementation, because this may be a very strong curriculum-based assessment for programs who may have not used that, but you can see there are a number of challenges. And it doesn't particularly fit the culture of a kindergarten classroom in school, and so many of those schools have opted for waivers out. So for the council, I believe the adoption that you made was a good choice in terms of being able to get that snapshot at kindergarten to do that. What we really hoped for you to see was that this is a small portion of a curriculum-based assessment. We have some challenges still ahead, which you all quickly identified. But that there are some potential data sources to look at as we move forward with the hub implementation, to be able to look at some of the instruction and skill sets there.
the other thing to pick up on what Janet was saying, this data can now be linked to children's SSID numbers. So that moving forward, we will have that opportunity.
I'd like to thank Lori for coming to do that.
Thank you.
Thank you.
Okay, council members, we are going to move into the director's report, and lunch is going to be delivered sometime in the next 20 or so minutes, and so we will take a break at the appropriate time, and just a pause actually to gather lunch, and so it's designed to be a working lunch. If you're here as a member of the community and would like to provide public testimony to the council, just remind you that no one would have to sign up. I haven't already done so, because that's something in the next 30 or so minutes. I'll call time and then we'll just ask you who you're on the testimony and schedule for that time. So then I'm going to go over 5 minutes at the end of the director's report to just make a couple of announcements about some work that going forward. Some of you have been involved in just the council doesn't know all of this. So I'll turn it over to John.
Thank you very much. I'd like to start with the article that's in your packet. Vicki Bishop sent to us sharing us the state of education for Native American children, and I know I've had comments from many of us as staff as well as council members that was very helpful. So thank you very much. And then I have a series of quick updates by different staff, so I'm going to kind of go through that because this is the perfect time for me to use this time. So the chair, you can also pull it up. It's important to do that. Dane is going to give a quick update on the Early Learning Data System Committee, as well as we can just go ahead and do the early childhood
Sure. So you may recall that the council helped designate a steering committee to move forward a lot of discussions around early learning childhood education system. We had our first meeting, it's been over a month now, but it was a fantastic first start, or not first start, carrying forward great work that came before under the Dallas leadership. So it had representation across Department of Administrative Services, Department of Human Services, Department of Education, and Oregon Health Authority, as well as council membership and beyond. And I think it was a good first start. We were getting ready to reconvene the next month and move forward that work. During that discussion, there was a specific presentation by our maternal infant early childhood visiting program, who, as part of their grant, have put forward plans for a home visiting data system. And I won't discuss the details, but the data system steering committee agreed to support that moving forward and to utilize the ELC Assistance Steering Committee as a steering committee for that work. So we will be working closely with them as those plans unroll. Currently, they're just working to get their contract ready to go. So there are a process prior to go to contract. So anyway, thank you for supporting that. I conclusion with Rob's ask, and we will bring forth updates as we move along. And I think the other one was just to update. I might have alluded to this earlier with the joint subcommittee proposal, that we are orchestrating some kind of collaborative organizational structure at the Oregon Health Authority to support our joint activities. Specifically, we have some top positions that will be based out of our OHG Transformation Center. We also have had a long-standing grant, federal grant, the Early Childhood Development Systems Grant. We had to recently reapply in a competitive process, and we were given a very high score to continue that work forward. Currently, it is refocused on the issue of development screening, and we are also moving that position to the Transformation Center again to make sure this work is moving forward in a coordinated way. So we are excited about that grant as well.
Megan Irwin and Lisa.
Questions for Dana about this piece? Or pieces, actually. Okay, sorry.
Megan and Lisa, do you want to both come up at the same time since you have both of those sweet topics? And Megan is going to give us an update on the bidder conference that is happening with the hub, so we can hear a little bit about what was happening with we call it the road trip, but go ahead and talk about that. And then Lisa wants to do an update on the rulemaking process.
Thanks, Shauna.
Now, rulemaking organization.
Chair Curtis, members of the council, I'll keep this brief, but wanted to let you all know how our road trip across the state of Oregon went in the first week of September. We visited 4 communities in 3 days. I think it was 1,000 miles, 100 people, a lot of interesting car conversations. I think we had 16 hours of time on the road altogether. We visited Medford, Pendleton, Bend, and Portland, and conducted applicant conferences so that folks who are applying to become early learning hubs have the chance to ask us every question they could think of and get an answer. All of the answers that we provided during those conferences were kind of unofficial answers, and then we answered them all in writing, published them in ORPN and on our RFP portal, and we're continuing to do that every Friday, up to about 10 days before the application is actually due. The main takeaway from the road trip is that many of our communities across the state are really digging into the details of the hub work in a really positive and exciting way. All of the questions that we got were very thoughtful. People had really gone through and written down their questions in a way that indicates just a level of intentionality behind the applications. It's exciting to see. There wasn't any, what's a hub again? We don't really understand this concept. I think we've really moved past that, and that was exciting. And the tone overall of every conference that we did was positive. I think folks had lots of questions. but I didn't get any sense of really negative pushback to the concept of what we're trying to do, and that was also really exciting. I will say that a couple questions that came up at the conference have raised some bigger policy questions that we'll need to address in the second round of rulemaking and in the next RFP. Just things that, even though we all worked on the application really hard and thought through as many of the policy considerations as we could, the field always comes back to you with things that make you look at things in a slightly different way. And so we will need to think about a process for addressing some of those bigger questions, but overall, I think really positive experience, and our communities are ready to do this. That was my takeaway.
Thanks for the incredible road trip and the extra effort for all of you. Can you may or may not be able, can you give an example of one of those policy questions?
Sure. So one thing that came up pretty frequently is how are we defining poverty? That's the one that's really stuck in my head. Our statutory definition of at risk talks about kids that are at or near the federal poverty level, but it doesn't actually define what or near the poverty level means. And programs across the state define it at all different levels. And we never got there in our RFA planning process, and I think we're going to need to consider how we want to answer that question thoughtfully in the second round of the RFA. Another question that came up, just to put in folks' brains, because I think it will take some pretty serious consideration, is what do we mean by served or service? And there isn't a consistent definition for that across early childhood programs in our state right now either. So those are two questions that came up that I think are going to be some of the toughest to answer and take the most thought and discussion.
So I was struck with the letters of intent and how many single counties there were, and I was hoping in this next process that some of those counties would maybe start seeing themselves together, and I just wondered if that happened. So as these groups came together to talk with you, did you get any sense that some of the counties were seeing potential that they hadn't seen before?
I can't tell yet. I think we'll really be able to understand that when we see what shows up in the applications. A couple of, there's one county in particular who turned in a letter of interest that's notified us that they're actually not going to go forward in round one. And I expect that might happen in a couple other instances. And then once we're through the formal procurement process, there's an opportunity to talk with them about how we might help them link into other work that's happening around them. But I really don't know how ready folks are for that, and we'll see when we see what comes in the application.
So I want to congratulate you on your strong work here. I think your previous professional experience has had a big impact in making you the public much successful. I think that as that responsibility of being a rulemaker weighs heavy on my brain, because I work with administrative rules all the time, and I would just encourage us in the quest for precise definitions and such to keep in mind that we want to be building a results-driven model as opposed to a process-driven model, and a lot of current rulemaking is based on really a compliance frame as opposed to an accomplishment frame. So I think we can cut some new, ground here. And I think as we look at, for example, definitions of poverty and such, I think we want to be sure that we're putting those in the context of 108,000 kids a year who need services to be successful. So a definition that gets us to a reasonable metric of market penetration for the 108,000 is the right definition as opposed to a more technical definition. Does that make sense?
Absolutely.
Other questions, comments?
Bring this up.
All right, so thank you very much, Chair Curtis and member of the committee. It's a pleasure to be with you here today, and I have a couple of things, all things rules, to report on. The first thing is I just wanted to let you know, late breaking news, at least for me, late last night I found out that the child care block grant was passed by the Senate Health, Education, Labor, and Pension Committee. So now that will move forward over to the House. So that was good news. They unanimously voted it in, and then of course, then funds the child care development funds that we have as well. So good to see that moving on that level. In your packets, you should have received a two-page overview on the Child Care and Development Fund proposed rule. We're at the national level looking at making some changes. And so that has been, it is out. In terms of looking for comments, or actually, excuse me, the comment period, they put some pieces out, took some comments in, and now they're taking that and they're digesting that at the federal level. Wanted to provide for you an overview of what those changes, proposed changes are. And as we are made aware of the process for any next round of input, we'll definitely keep you apprised of that, because I want to make sure you as a council have that information, and if there's some things that we can take forward, then providing that vehicle to be able to do that. I think, from my perspective, the proposed rule changes are in line for the most part with where we're going in the state of Oregon in terms of providing better support for providers, parents, and states to be able to collaborate and work together to make sure that kids are in a safe and healthy environments and also are prepared to succeed. And so I think that's great. And we in Oregon are doing some amazing things through hubs and through the QRIS and the quality learning environments to really bring that home and make that real for our children. So it's exciting to be a part of that. So again, I will keep you apprised of the processes and timelines and things that will be a part of this. And if you would like anything more in depth than what is provided here, be happy to provide that at a future time. The third thing that I wanted to talk about is, as has already been alluded to, is the rulemaking process as it relates to the hubs. You'll remember at your August meeting, you adopted the temporary rules. Those have been filed. They were filed directly after the meeting. And so this begins the period of time where we have 180 days to file those as permanent rules. And so that begins the process that we have in front of us to make some of the changes that Megan discussed. And so we'll be working with Megan and others to make sure that the rules are really clear and understandable and really taking into account what you're saying, Lynn. I totally agree about how can we provide information and rules that are clear and also get to that outcome driven and not get so prescriptive and kind of twisted in some of the prescriptiveness that some of our rules do. So certainly understand that. We'll be working with Megan and also with key staff at the Department of Education in terms of the actual process of filing those rules. In general, we're looking mid-October to file the intent with the Secretary of State that we're making some adjustments to the rules, and then set forward a schedule in terms of the type of input that we're wanting to gather and how we want to go about doing that, whether that's online, email, focus groups, those kind of things. So that will happen over the months of primarily November and first part of December. And be including you along the way, and then be bringing back the revised rule to you to adopt, and then or send back for additional changes, and then we'll get those filed. We're looking right now at a mid-February time that we would need to do that. Otherwise, the temporary rule goes away and is expired, and you kind of start all over. So we want to avoid that at all costs. So we'll be keeping you up to date on those timelines.
Comments or questions from the council?
And I'm sure this is my confusion. We got one email from Alyssa and staff that has at the bottom a list of important dates, and I think these pertain to the hub evaluation process as opposed to the rulemaking process. So I get that right? And I just wasn't clear whether we were being asked to block out these dates, which dates were being asked to block out, and what times were being asked to block out. So that where we're going to discuss that now or later, but I'm not clear on that.
Lynn, for the hub evaluation, why don't I follow up with you offline to just make sure all the dates and times are clear?
Thank you. Yeah, so just to clarify, so some and I have a question about this as well. So some council members have indicated, remember we had a sign-up sheet that went around in a previous meeting that indicated a willingness to review portions or all of applications, and we're putting a firewall between our communities that we may live in or work in, and maybe producing applications and our ability to, for conflict of interest purposes. And so I think that email was for, we didn't all get it. It was intended for those of us that signed up. And I think it probably deserves some clarification. Yeah, so that's good. My question, and for the two of you, is about the firewall between the application process and sort of the content and the decisions of all this. We have, it gets very confusing because we have round 1 application, we have rulemaking, we have round 2 application that actually happens in round 5 succession. And I think it is our intent, it's been our desire as a council to be able to provide some feedback to round 1 applicants so that we have presumably a better prepared set of round 2 applicants. And I'm just curious, I don't know who it's a question for, maybe a question for John or Megan, I don't know, or whoever. What are we doing from a staff perspective and a council weigh-in review perspective to build that firewall between technical assistance we may provide and those of us who may be reviewing applications and making decisions?
And maybe I'm going to let you go ahead and start with that. Does that help? Yeah.
It's a really important question. So I think it sounds like there's some work to do to get really clear about the round 1 evaluation process and then make some pretty clear distinctions between round 1 evaluation and everything that comes with that and the role and responsibility of that. The work that will be done parallel to that within the same, sort of the same time frame around rules. And then what the actual timeline is for the second round release of the RFA. Including any changes that we decide we want to make to that, and the evaluation and technical assistance phase of that. The good news is we actually have it all timelined out. I think trying to verbally give a bunch of dates right now will actually wind up confusing people more. So my proposal to you as a council, and let me know if this is acceptable, would be to put that all together into an easily understandable package and send it out so that you can just have a really clear line of sight to what that timeline looks like and the distinction between each of these phases, some of which overlap with each other.
Right, and I think, I've been really good about carrying my little card and just
yes.
Talk to me about this, this person about this. But, I think that because we've been good about that, people in our own communities say, so when can we talk to you about it? So it's, and I don't want us inadvertently, out of good intention, to create a problem.
Right.
So I think
yes, we'll get that clarified.
I have a question to follow up on your statement about feedback to those applicants who, was it feedback? What would our role be as far as giving back feedback to applicants who might have tried out in the first round, didn't make it, and now are wanting to apply in the second round? Because that was asked in Southern Oregon when we came down tonight, and so I'm just curious as to what feedback are we going to give specifically to applicants?
So we know for sure that they'll be able to download the evaluator comments on their application, and I think we should actually give that proactively. And then it's an open question with our procurement leaders who are helping us stay within the bounds of what procurement rules say we need to do as to what kind of conversation we can go and actually have with people about that. Because round 2 will still be competitive, and we may have competitors in round 2 that didn't participate in round 1. But at minimum, people who do participate in round 1 have access to evaluator feedback. It's actually public record.
Well, if we could get clear on that, though, that would be excellent, because I know our communities are asking us.
Yes.
I think that's the gist of my understanding. I want us all to be clear about the timeline and the firewall and where we engage and where we can't engage. And we're going to start, it's going to lapse here very soon.
Yes. So,
From round one to go ranking to tech, to feedback to round two.
And thank you for asking those questions, because I think we get caught up in some of the process and working on a day-to-day basis, so we'll definitely look at that clarification for you. And really knowing that you are the representative of your communities, and you'll be asked first, not us.
Are there other questions or comments for this section of the I have one more. On this one, kind of jumping around, this is the chapter involved in proposed rule. I presume, I just want to confirm that the council will have an opportunity to weigh in on this at some point. This is just more heads up.
it is more heads up, and it will depend on how the federal government wants to take in that information. So I'm gonna say guardedly yes, because it'll depend on their timelines and how they want to do that.
We won't really get to weigh in. The feds will adopt some set of rules. I mean, the wait-in time is passed. There was an open period that we could have responded, and I think Oregon did respond, but the council didn't go through it at that point. So now, my understanding is unless they are reopening it.
They may reopen it. That is what
You've heard.
I've not heard that officially, but the word is that they're considering doing that.
And it might be good then if it has direct implications for us. I mean, so it happened this summer, and I kept asking, is Oregon weighing in? Is Oregon, anyway, there are sorts of good and bad things to think about, and it was, anyway, so maybe, Lisa, if it reopens, maybe we want to directly involve the councils.
Absolutely, which is why we wanted to bring it here today. Correct.
The actual
correct.
time period happened prior to the fact that when we had our division, and so this was still in the chapter, was in
And
their
beforehand.
own elements. And so I think this is one we missed, and we want to make sure, and that's what Lisa is doing, is bringing it back. And so if it does reopen, we will definitely bring it back to the council to weigh in from that state perspective.
Can I just say, having been a former Fed, you could probably feel strong feelings about something, submit it after the deadline. While it might not officially be part of the response, there's probably a good chance it would still get right. So.
A couple other quick things is the state of Oregon was selected to the state of Oregon was part of the 9-state consortium that was adopted actually awarded by the federal government to look at a K-3 consortium. North Carolina is the lead applicant, so we will do that. We only know that we were part of a successful consortium. We have no idea what that means moving forward, other than the fact that if you think about a system approach, is it really moves from kindergarten through third grade reading in terms of how we look at children's progress. So we see that as being part of 9 states looking at that journey moving forward. So we will have a further update for you as we go through the beginning understandings of what that means. We know that the other thing that it will mean to look at in the next 4 years is as we look at our early learning guidelines and standards, how those may look a little more different in the next 4 years to do that. And legislative days, we just finished, actually we finished it before they were finished, and so we had a series of meetings that the team did, and I have that in your right-hand packet, right-hand side of your packet in terms of who our visitations were. So you can see that we did visits. We also had 2 hearings that we were requested to do. The House Human Services requested a hearing to hear the transition and the update. Mostly, I think they were looking at the transition into the Department of Education, as well as a very quick update. The Human Services was who had been hearing most of our work and higher education, community colleges, and the K-12. It was a 5-minute update, but I think that what we all realized from that hearing is that we need to spend more time with the Senate Education and updating them in the work of the early learning, both the council and the division. So that was a good heads up for September. And then finally, what I wanted to do is give you a really quick update in terms of what to think about for the future. We have exciting things happening in terms of at the November meeting. It is now time to look with the quality rating improvement system, is that there are going to be some announcements coming out of those providers that are star rated. And we want to tie that celebration and that recognition in with the November council meeting, as well as looking out broader to the state to make sure that we understand that as providers get their star rating, that's an exciting time, and there's been a lot of work to go into being able to do that. So we will have some more information in the child care work coming forward with that. Also, we're working with, if you remember, with the strategic initiatives from the Oregon Investment Board. There was one that awarded $1.7 million for early literacy grants as part of the strategic initiatives to look at how we reduce the achievement gap in early literacy. We're working with a group of stakeholders to come forward with some ideas about what they think is important for the field to look at how we would do those awards moving forward. And so what we'd like to do is bring the council some ideas forward on that. The second one is that the Kindergarten Innovation Fund, which was also put into House Bill 2013, think about in the future how we look at that moving forward, which may be a joint effort. And that's right here, so I'll just link right into you.
So let's pause though before we do that, because the early literacy one was one of mine that I was going to talk about, and just see if council members have any sort of guiding thoughts to get started. Marlene's participating in that, I think Jim was going to and isn't able to. So as that group of stakeholders has a conversation about early literacy, is there anything that council wants them to keep in mind? Just as maybe broad guideposts. We will get something back from them and as a set of suggestions, but
just a clarification, is this paragraph or is it connected to that ready to read through the libraries? It's not,
It actually is very open to people to do that, and I think that you will see ready to read as some of those possibilities to be able to do. And actually, if you would like, this is one of Brett's initiatives, and he could come up and give you just maybe some of the guidelines that are in the legislation that you were looking at, so that there might be a way for council to
that'd be great.
Brett,
like you could do that on the slide, that'd be great.
Sure. Do that.
Well, Brett's coming up. Who is the group that is charged with this next step?
So the council was awarded the resources to do this early literacy piece, but it is tied to OEIB's strategic plan. So we have sideboards from OEIB, we have sideboards from legislation. Brett will explain that, and then JADA has called together with the stakeholders to help provide some input from the field about what they do about in advance of council's consideration. And Marlene's participating as a council member in that conversation. So we'll look forward to hearing about that. But I just, because that's coming up, I thought it would be helpful for us to just know that it's coming up, and if there are thoughts that we want to put at this point. So.
All right. Well, thanks for giving me a few minutes to chat about this. So the language in the statute is actually fairly broad, and there's not a whole lot of it. So what that means is that gives communities an opportunity to be really innovative with how they structure these partnerships around early literacy. And it also means that our challenge is to provide them some structure without being overly prescriptive. big picture, focus is certainly on kindergarten readiness and third grade reading proficiency. And some of the things that the language in the statute highlights are partnerships with libraries, partnerships between nonprofit organizations and schools, as well as certainly family engagement and engaging different types of adults that interact with children, and also materials development and leveraging technology. So that creates a pretty wide world of opportunity there. Some of the, just as an example, one of the things that we asked the work group that will be meeting next Monday to look at is programs such as Reach Out and Read that happens through doctors' offices to promote literacy. So creative types of partnerships along those lines. What questions do folks have at this point?
Thoughts from council at this point?
I just want to thank for the comments, but at the heels of the joint subcommittee proposal, thinking about early literacy as a step along the road to the joint outcome now of kindergarten readiness, I think this is a great opportunity to think about those partnerships. And my understanding is that Reach Out and Read was given funding through the legislature separately from the strategic initiative, but regardless of the funding, having that partnership and being really purposeful, I think is great. And I know I've talked a bit about it, and it sounds like it's on the way, but I think this, building off of this joint subcommittee's vision, this is a great, really concrete example of how we can build strategies together in diverse ways at the community level.
I would just advise that this effort as well to remember the equity lens and thinking about this. There's research out recently about the importance of home language as a core pillar for early literacy and for future language and reading skills. And so there are some practices and research that's informing that. So in thinking about our diverse cultures and the importance of language at any kind, type, whatever, at the early stages, that's a really important part of that.
Great, thanks.
And I think, Krista, that because this came out of strategic initiatives piece, I really now to land in our responsibility bucket, but I think it is part of their strategic initiatives to reduce the achievement gap. So your comments are right on, and it made me, actually, this whole thing has been making me think about some of the conversation last night at the table that Krista and Marlene and I sat, where members from the Warm Springs community were very clear about the lack of availability of books for some of the young children. And we had a fourth grade teacher at our table who said she has kids in her class who don't have books and never have had books at home. And so the extent to which we can match the equity and the achievement gap for those kinds of things. The other thing I would say, just as a council member, is that since one of our charges is to bring this all together and to coordinate it, I would want to make sure that whatever we end up doing eventually is attached to hubs and all of our effort to coordinate the stuff in local communities. We don't just add a programmatic layer to the cacophony of what's already out there.
And I think there's a real point on this literacy stuff that I think we can use it as the evidence that the system is not integrated successfully in any way. Because there are boxes of books sitting in Portland today, donated, ready to go, that, like, who needs them? Where do we get them? The connections aren't made, the resources are there, they're being wasted and squandered. I mean, in a computer age, it seems ridiculous.
All right. Thank you. Sure, absolutely.
Just with a question regarding the ready, what was the one that was done out of the doctors?
It's Reach Out and Read.
Reach Out and Read. And you're saying that was funded separately?
Yes, so yeah, my point with that was just sort of holding that up as an example of the type of partnership that communities might develop, and that we might ultimately fund through this particular stream of funds.
Thank you for the clarification.
Actually, kind of a clarification is most of the initiatives had specific funding streams that they expected to go to. So this actually is really nice because we can look at all the early learning initiatives. So when this came forward, I think people didn't understand all of the work that the council were doing. And so this is our real chance to tie many of these things together, even though they are separate funding sources. So that's
Your conference is ending now. Please hang on.
I'm done.
So just a process check for council members. If you do not have anyone signed up for public testimony, we're going to apply for the rest of the agenda. Folks can choose to go outside in the lovely weather and have lunch or take a brew or whatever. Okay. So at the same time that we are charged with coordinating all of this, we got some interesting allocations and charges from the legislature that are outside of our charge of helpness and coordination. This is a great example. Another example is the Partnership and Innovation Fund. And I'm sort of starting to think of them as rock and roll money, right? Where we may be able to use them to create some real movement. So the Partnership and Innovation Fund, again, some legislative parameters around that, but really the purpose is to create innovative connections between the early learning community and the K-12 or K-3, as the case may be, schools in communities, and innovative ways to do that. We've heard some of those innovative connections as we've traveled around our state. There are many others we haven't heard about, and there's a whole lot yet to happen. But that's about $4 million that will come our way, or is available to come our way, that we need to allocate. And so there'll be a separate process for application for the purposes of making those connections. So because this is, it did fall to us in our bucket of responsibility, but because it is early learning in K-12, we will be going through an exercise with the OEIB to try to establish criteria between the two policy boards for the making of these grants. And we're not sure exactly the shape that may take. One of the options is that in the one-member meeting in Portland, we may, as Chad indicated earlier, try to have some joint time with OEIB for the purposes of doing this. There will be some staff work done in advance, and there will be an opportunity, council members, if you're interested, to weigh in on that in advance of the draft criteria for consideration coming to the two policy boards. So if you're interested, let me know. Otherwise, you can expect in November, either in a joint setting with OEIB or separately, that would be considered like we did with the staff person from the board, health policy board, consider OEIB consider. But in November, we would anticipate seeing some draft criteria. And we would set the criteria together with the OEIB, and then there would be a process for allocation of those funds. Questions?
I have a question about administration of these new funds. So when the legislature moved it to the council, did it also move the administration and management kinds of issues to the division?
Yes.
So, in addition to all the other work that the division integrated, that will be, these two programs will be administered by the division.
Yes, and rules will be made and allocations will be made by the council. And so it's part of my, I mean, it's fabulous. You know, the glass half full views, it's rock and roll money, we can use it for incentives. We've talked about that a number of times, sometimes these are incentive, sources of incentive funds. The last half empty fear is that we layer a program, run a program upon a program, and that we make
some of the priorities they've heard from some of the communities who may not have heard.
Other questions or comments about this piece? So council members, moving to the end of the agenda, we do not have minutes for the testimony, so we are in wind down mode at this point in time. Let's offer the opportunity for closing comments by council members and then a couple of logistical announcements about what comes next in the village. So council members, closing thoughts or reflections on our meeting over the last 2 days. Teams.
I'm struck by the low level of involvement of the people who are usually in front of us. And I mean, it's already thinking, is it because we're far away? But then when we were in Arden, which is really far away, there were a lot of people there. So anyway, I'm struck, I don't know what it means, but I'm struck, and it seems like we should think about it.
It's very noticeable. We have had standing room only on the door at many of our meetings, so it's very striking.
Last night, I asked people who were going to be today. And some of them, they said that there was just other big things going on, and it just were obligations in general. So I think that there was just a lot happening this week.
But we have a group that has traveled wherever we have traveled.
That's true.
Right, they aren't.
Yeah, they're not there. Yeah.
One other question just to the traveling group was that was Central Oregon, because the number was smaller than we did when I was there with the Hogs. Was it smaller than, I wanted to ask that, than the other places you were attending? So maybe we're just, you know, I mean, there might be
Actually,
correlation.
Central Oregon was probably our lightest attendance in the that we had.
But I also think that the big thing everyone was waiting, hoping to learn about, what's it gonna be, that's out in the market now. So everyone's busy doing that work. And so we're just a little less interested.
We're about to get really, really interesting.
That's exactly my point. So this seems to be quiet before the storms.
Other closing thoughts or reflections, council members?
It was just a real delight to be on the reservation and to be exposed to the cultural traditions that were a part of all of our processes. I was yesterday, and I think it's helpful to be connected and understand that rich part of culture that creates communities, and to be reminded of it when we're thinking about the work we're doing.
I want to thank the staff. A year ago, Jeff said this yesterday, I'll just repeat a version of it. I mean, a year ago, we had John, which was fabulous. But now, we have a very capable, very bright and talented staff who I have no doubt will help take us where we need to go. And it is no small amount of work to put together a meeting like this. And so I just want to thank all of you very much for everything that you're doing and all of the incredible work you're about to continue to do as we get ready for hubness in our states. So our next meeting again is scheduled to be in November. We're moving the meeting to Portland to accommodate the possibility of a joint conversation with OEIB, to accommodate the celebration and announcement of the star-rated child care providers. So that's the primary reason we shifted from Denver, is just to accommodate all this. Plus, Arlen couldn't be there because she'll be on family leave, so it's all the reasons. And there is a doodle poll out about council availability, and again, we're trying to match that up with OEIB availability, so there'll be some limitation around that, but we will do the best we can to accommodate.
we might pull that, do go back and start again with that. So why don't you just wait a little bit on that? We have pretty clear that Wednesday and Thursday that week will give for council members, but let's pull that back on.
Okay, so expect a new poll on that.
And we'll call it the new revised. The second thing is and one of the reason that our dates are a little bit uncertain at this point is remember with this new rulemaking responsibility that you have, the schedule that we have kind of looked at for every other month may or may not work. We're trying very hard to fit that in. So we're looking at that a little bit too because I think this is new for us also.
Right, Councilmembers, anything else? Okay, lunches are marked, and we're going to invite you to take one now. Whatever it makes sense for you. Thank you all very much. We are adjourned.